Hi Abby, my name's Brittany. I just washed my hands. I'm a student physical therapist at Mizzou. How are you doing today?
Good.
I see you have a referral for physical therapy. You had a right total knee replacement, is that correct?
Mm-hmm.
Okay. Well, what we want to do today is just, I want to get some strength measurements and see how your knee's moving. I also just want to look at some sensation and see joint proprioception, which I'll tell you about, but it's just kind of moving your ankle, having you mimic some movements. You understand all that?
Yep.
And then after that, we'll set you up, take some more measurements, get you in the wheelchair, and take you to physical therapy. Okay? So can you kind of repeat to me what we'll be doing?
We're going to do some measurements and move my ankles around and go to the wheelchair to physical therapy.
Good. And that's okay with you?
Yes.
Okay. We're going to start with vitals, okay? So I'll go ahead and take your blood pressure. Is there anything that I would need to know? Any previous surgeries, such as a mastectomy, that you've had in the past to prevent you?
Nope.
Okay. Go ahead and put your arm down then. Okay, looks like that's going to fit well. Okay, go ahead and relax. Can I palpate that area? Good. Lock it in there. Here we go. All right, I got about 122 over 78. Is that normal? You know what you guys have normally around? Yeah. Okay. Okay. Now I'm just going to go ahead and get your heart rate too. So just hang tight there. Okay, so I got 84. That. All right. So now I'm just going to go ahead and check how your unaffected leg's doing. So what's your pain on your right leg on a scale of 0 to 10, 0 being none and 10 being the worst pain you've ever experienced?
Probably like a 5.
A 5? Okay. So do you live with anyone?
Yeah, my dad and my mom.
Are they kind of helping take care of you once you get released from here?
Yeah.
Okay, good deal. Alright, so what we're going to do is I'm just going to check your motion in this leg, okay?
Okay.
So I want you to bend up with me, good. And back down, and then we'll come out. We'll go back in, and then let's bend you a little bit, and let me see your rotation. Really well, okay. And all the way up, good. Alright, and then can you just raise your foot up and down for me? And how about just bring that big toe as close to you as you can. Good. Okay. And then I'll check your right side too. So I'll bring that back down for you. And I know that knee is probably pretty painful, so I'll try and stay from keeping that from moving too much.
Okay.
Little motion's all right though. That's good. We want you to move. So, without really bending your knee, can you raise up to bend your hip at all? Just raise your whole leg up.
I need help.
How's that?
Yeah, that's better.
Good. Okay, and I'm just going to bring it out too, okay? And back in. That looks pretty normal. Can you raise your feet just like on your other one and down? And how about that big toe? Good. Okay. So now I want to just try and take a measurement to see how much you can bend that knee. So go ahead and bend it for me as much as you can. All right. Is that all you got right there?
Yeah, I think so.
Okay. I'm reading right around 48. I'm going to go ahead and try and just add a little pressure. Tell me when it starts to hurt too much, okay?
Right there.
Right there? That's pretty good. I got you at about 54. Okay, now I want you to try and straighten it as much as you can, okay? Try and get that knee to touch the table. Right there?
Yeah.
Starting to hurt?
Yep.
Okay, and that is right about 40. I'm going to go ahead and try and straighten you down a little bit more. Good. I got you to about 31 degrees from full extension. So that's not too bad. Okay, and then I'm going to go ahead and raise this one up too. Okay, so the next part is I just want to check the sensation in your legs and see if they're the same or if there's any different, okay? So first I'm just going to do this unaffected side. So what I'll do is you'll have to close your eyes, and whenever you feel me swiping, just like this, it's just going to be really light. I just want you to say yes, okay? And I'll do a series of them. I'll let you know when you can open your eyes. So go ahead and close them.
Yes. 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 Yes.
Good. Okay, go ahead and keep your eyes closed. I'm going to do it on this other leg too, okay? On your right side. And just tell me whenever you feel.
Yes. 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 Yes.
Okay, very good. All right. So the next thing I want to do is see your joint proprioception. So first what I'll do, I'll tell you, you can keep your eyes open to kind of see what I'm doing. So anyways, I'll bring you up, down, out, and in, okay? So you close your eyes, and after I stop, tell me which direction it's in.
Okay.
So go ahead and keep this closed.
Down. In. Out. Up. Down. Out.
Good. Okay, now let me see on this side. Go ahead and keep your eyes closed.
Okay. Up, down, in, out, up, down.
Okay. That's good. And then on this one, I just want you to mirror what I do. So whenever I start to bring your foot up, do the same thing with that one immediately, okay?
Okay.
In any other direction I go. Keep your eyes closed. Good. And Abby, I'm sorry, I just can't remember if I did. I just want to check your sensation in your knee again, okay? So just go ahead and close your eyes. This is, what I'm going to do this time though, it's just a little different. Just tell me if these sensations feel different from one another, okay?
Okay.
So I'm going to do it on each side, so wait till I do it on both sides. Okay, ready? Eyes closed. Is that the same as that?
Yes.
That and that?
Yes.
That and that.
And you only did one.
Which side did you feel it on?
This one.
Okay. That and that.
Yes.
That and that.
Yes. The same.
This, same as that.
This one's lighter.
Okay. What about this and that?
Felt this one.
Okay. Here and here.
The same.
Here and here.
Same.
Here and here.
Same.
Okay, good job. Sorry about that. Alright, so what we want to do next is sit you up. I'm going to bring this down. How's your upper body strength seem to be?
Good.
Pretty good? Okay, so what I want you to do then is kind of, in a minute, you'll prop yourself on your elbows. This leg is non-weight bearing, so whenever we do sit up, don't slam it to the ground or try and stand or anything like that. I'll assist you with that leg, and then once we sit up, you can bring this one over. It's totally fine to put weight on that, okay?
Okay.
So, I'll say 1, 2, 3, go, and then we'll start turning, okay?
Okay.
1, 2, 3, go. Good. Okay, you can bend that one down, and let's slowly bring this one. There you go. Okay, and if you want, you can kind of get your gown situated if you want, and we can take this sheet off. I know the rooms get a little warm. It's a little colder out in the hall. Okay, and let me put this on you too first. Okay, are you dizzy at all?
Nope.
I'm going to go ahead and put this gait belt on you for when we do get you into the wheelchair, but we won't do that yet. You got that situated there? Can I take this off?
Yep.
Okay. Okay. So are you on any pain medicine?
Yeah, they gave me some earlier.
Okay.
Probably need some more though.
Yeah, well, I'll make sure I tell the nurse that for later. We just want this a little snug in case you were losing balance. Okay, so before we take a look at your knees, I want to just do a general screen on your upper body strength, okay? So what I'll do is I'll have you hold a position, and then I'm going to try and resist you. I just want you to try holding that. So go ahead and bring your arm out to the front. Okay, so hold there. Good. That's a 5, and bring it out to the side. Hold there. 5, and back. 5. Okay, let's check that rotation. So just hold there. Okay, I'm going to try and push you out. Don't let me. Good. I'm going to try and push you in. Don't let me. Good. And I'll go ahead and check your adduction too. So I'm going to try and push you up and don't let me, okay? Good. Okay, and now I want to check your elbow flexion. So hold it right there and don't let me push you down, okay? Hold. Good, that's a 5. Let's do extension. So just go the other right there and don't let me push you in. Good. Okay, let's see what else. Go ahead and keep your arm like that. I'm going to try and bend you, okay? Move your hand. Just don't let me do that. Good. 5, and now the other way. Hold. Good. Okay. Go ahead and bring your wrist up and hold there. That's a 5 as well. And now up there. Hold. Good. 5. And now I want you to squeeze my fingers as hard as you can. Good. That's a 5. All right, let me mark a couple of these. Okay, so I just want to test strength on this uninvolved side still. What I'll have you do first is just kind of lift up on your hip. And it's the same type of stuff we were doing with your arm. So just hold there. Good, that's a 5. Okay, and now I'm going to try and push your leg out and don't let me, okay? Good, and now I'm going to try and push it in, don't let me. Good. Okay, and now I'm going to try and pull your leg out, don't let me. Good, and then straighten it and don't let me push it in, okay? Very good. Okay, and then I'm gonna bring you out here. Don't let me push in. Those were all 5s. Very good, and now bring your leg in and don't let me push you out. Good, and then lift up on your foot. Hold. Good, push down on your foot. I'm gonna just check this. Good, and now your big toe, can you lift that up? And I'm going to try and bend it. Good. Okay, and before we do anything else, Abby, I want to slip your shoes on. Do you have any socks?
No.
Okay. Do you need to lay down for this, or are you okay in sitting?
I'm okay.
Good. And I'll be really careful with this one. We just want to make sure we get those on here as soon as possible. Okay, so for the leg, I know that this side is in a lot of pain. I'm just going to check I'm just going to do like that kind of testing, but just on your hip and on your foot. I won't do that at the knee, okay? So go ahead and try and lift your hip up a little bit if you can. And hold there. Be careful of that knee. Okay, and then don't let me push you out, okay? Hold. Good, and now don't let me push you in. Hold. Good. Okay, now can you lift your foot up? Hold. And now point it down. Hold. Okay, and how about that big toe? Good, 5s on those. Okay, and then I want to just take another measurement while we're in sitting before we go down to therapy and check this flexion and extension again. So it's the same like you were laying down. Go ahead and bend that knee as much as you can. Okay, is that all you got?
Yeah.
All right, that's pretty good. And I'm reading right about 59 degrees of flexion. I'm going to try and bend you a little more, okay?
Okay.
How's that?
Right there.
Right there? Okay, let me get another read in. Try and get this real quick. And we got you to about 64. That's pretty good. Can I see how much you can straighten that leg? Right about there?
Yeah.
Okay, we're looking at around 43. Okay, I'm going to push you just a little more. Tell me when.
Good.
There. And that's at about 36. Not too bad. Okay, go ahead and relax. All right, I think we're about ready to move, yeah. Just writing a couple of these down. All right. So, I just want to make sure this wheelchair is locked. Oh, jeez. Oh, here we go. Sorry about that. These hospital wheelchairs, you know.
Yeah.
Sometimes. Okay. So the wheelchairs are locked, and what we're gonna do is, you feel like it seems like you have good strength with that left leg. You feel okay with it?
Mm-hmm.
Okay, so this is non-weight bearing at all. You cannot put any of your weight on there. What I'll have you do is I'm gonna help you up. You can use your arms, and just stand only on your left leg, and then we'll kind of pivot. I want you to reach for here, and then we'll go ahead and sit you, okay?
Mm-hmm.
All right, so I'll say 1, 2, 3, stand. So 1, 2, 3, stand. Good. Reach over. Lean back. There you go. All right. Now I'll put that elevator thing up and then set you right there. Let me get this sheet for you in case you do get cold in the halls. I'm going to leave that gate belt on. All right, you ready to go on down?
Yep.
Okay.